Good morning. Convening our committee on health and homelessness. Today is Friday, March 17, 2023 at 9 o'clock a.m. in conference room 329 here at the State Capitol. Welcome members and welcome to the members of the public who are here and who are here on Zoom. As per the practice of this committee, we do have Zoom testifiers, and I just want to inform you that if there is any kind of difficulties, we may have to pause the proceedings. And I ask that you just work with our very competent IT staff to be able to address any issues that may be happening. I'd also say that it is the common practice of this committee to do decision making at 11:30 a.m. typically, but we may, because of time constraints today, we may be doing decision making earlier. I will make that determination as we continue through this hearing. So on that note, members, let's start off with Senate Bill 900. This is relating to the Hawaii State Health Insurance Assistance Program. We have testimony from DOH, Executive Office of Aging, in support.
Good morning, Chair, Vice Chair, members of the committee. I'm Caroline Kadirao, Director of the Executive Office on Aging, and thank you so much for scheduling Senate Bill 900, which is to support our state health insurance and assistance program. We stand in strong support of Senate Bill 900, which asks for 3 permanent program specialist positions for the office at an amount of $229,000. Within our state, the SHIP provides free, unbiased counseling, education, and support to Medicare beneficiaries, their families, caregivers, and soon-to-be retirees by phone, email, and in person statewide. In the last 30 years that this program's been in existence, our state has increased the Medicare population by about 300%. In 1992, we were at 133,000. Right now, we're standing at about 296,000 Medicare beneficiaries within our state at ages 65 and older. Hawaii is also the highest in longevity in the nation at 81.3 years of age. The cost of living is double the national average. 11% of the population lives in poverty and 4% are uninsured. This all has negative impacts on health outcomes and the cost of health care. Again, like I said, our SHIP has provided this counseling for over 30 years with 2 staff, while the Medicare population has increased by 300%. And we need to, with the additional staff, we'll be able to meet our growing demands for this population, which would include continued outreach, recruitment, retention of our volunteers, data collection, analysis, and reporting. And we recommend this bill as long as it doesn't impact the administrative budget, and I'm available for any questions. Thank you.
Thank you, Ms. Kadirao. We have testimony and support from Kirby Shaw, Disability and Communications Access Board. Testimony and support from PABIA, Policy Advisory Board for Elder Affairs, Beverly Gotelli, in support. Testimony and support from AARP Hawaii, Audrey Suga Nakagawa, via Zoom.
Good morning, Chair, members of the committee. I'm Audrey Suga Nakagawa, Advocacy Director for AARP Hawaii, and we're in strong support of this bill, as everything that the Executive Office of Aging have echoed, have stated. We completely concur. There's a great demand and need for more information, and the SHIP team really needs more support to reach out and provide the timely information that's needed by the community. So thank you so much for allowing us to testify in strong support of this bill.
Thank you, Ms. Suga Nakagawa. We have testimony and support, Catholic Charities Hawaii, Rob Van Tassel. Testimony and support, Hawaii Family Caregiver Coalition, Gary Simone. We have numerous individuals in support, Mei Fujii via Zoom. Ms. Fujii, if you're there, and followed by Shari Nagatani. If you could unmute. Ms. Fuji, it appears that your connection may be not working. We do have your written testimony. I'm going to ask, is Sherry Nagatani there?
Yes, I'm here. Thank you. Thank you for the opportunity to, my name is Sherry Nagatani, and thank you for the opportunity to testify on behalf in support of SB 900 As a University of Hawai'i MSW graduate student specializing in the field of gerontology, I witnessed the increased needs for services and support for older adults here in Hawaii, specifically for their healthcare related needs. The Medicare program is complex and difficult to navigate as a student, and twice as likely or more to be for older adults and their families. According to the National Council on Aging, current studies have shown that older adults routinely make mistakes when selecting Medicare plans, resulting in costly consequences detrimental to their overall well-being. Hawaii SHIP educates and helps older adults with their Medicare plan options, questions about current coverage, and identifying potential eligibility for financial assistance. As a graduate student, being told a kind gesture of "thank you so much, you have been such a big help" as a volunteer for Hawaii SHIP, at first I did not know what to do, replied by the client, has been fueling my drive for advocating the needs of our older adult population. Thus, the dedication of 2 full-time employees and a team of kind-hearted volunteers and being the go-to person for Medicare-related questions for the community are the real heroes. Hence, as a future social worker and advocate for older adults, I strongly support SB 900 relating to the State Health Insurance Assistance Program, which would provide appropriate funds for 3 program specialists within the Executive Office on Aging for Hawaii SHIP. Mahalo.
Thank you, Ms. Nagatani. Members, we had also late testimony from Colette Brown, Professor Emerita of the Thompson School of Social Work and Public Health. Ms. Fujii, again, we do have your testimony submitted. I'll let you work with our staff to see if you can get connected, but if not, we are going to move on to questioning now, and we can come back to you if you are able to reconnect. Members, any questions? I have a question for Ms. Katarao. I really appreciate the work that this program does. Would you be amenable to language where we include into the progress report certain things that we would like a report back on, including but not limited to the program's outreach and penetration rate with Hawaii's Medicare population, information about the number of uninsured who we were able to get coverage for, as well as the outreach to low-income subsidy for low-income subsidy programs such as Medicaid, Extra Help, and Medicare Savings Plan.
We'd be happy to do that in our report, yes.
Okay, thank you, Ms. Katarao. Members, any other questions or concerns? Seeing none. Senate Bill 1378, Senate Draft 1. This is relating to unlicensed care homes, part of the governor's package. Members, we have testimony in support from Department of Health, Dr. Fink or his designee.
Good morning, Chair, Vice Chair, members of the committee. Happy St. Patrick's Day. I'm Keith Ridley, Chief of the Office of Healthcare Assurance here on behalf of Director Fink. The department stands in strong support of this admin bill, and we also appreciate this committee's passage of House Bill 914. This bill, Senate Bill 1378, is very, very similar. And I also wanted to point out that we appreciate and accept the technical amendments and clarifications made by the Senate Committee on Health and Human Services. And I'll stand on the remainder of our written testimony, and I'm available for any questions.
Okay, thank you, Mr. Ridley. Department of Human Services, Kathy Betts or her designate comments.
Aloha Chair, Vice Chair, and members of the committee. My name is Daisy Hartsfield. I'm the Administrator for the Social Services Division. I'm here on behalf of the Department of Human Services, Director Kathy Betts. The department did submit testimony, and if this bill should pass, it will not impact the delivery of services provided by Adult Protective Services. Anytime we receive a report involving a vulnerable adult in residential care, we automatically cross-report to Department of Health, OCA, which is the Office of Healthcare Assurance. And I'm available for any questions. Mahalo.
Thank you, Ms. Hartfield. Members, we have numerous testimony in opposition by individuals. Do we have any testifiers on Zoom? Any testifiers here in the room? A quick question, both for DHS and Department of Health, but we'll go with Department of Health first. Members, did you have any questions? Is there any reason why we should not pass this? The date is good. I'm curious if it's going to conflict with the other bill that's moving, or is this something that we can pass with a clean date?
The date is fine.
Okay, same question for DHS.
Chair, we would defer to DOH, and with them being okay with it, we'll be fine with it as well.
Okay, thank you. Members, any questions? Go ahead, Representative Kobayashi.
For DOH, do you know the reason for this opposition, which seems to be organized?
I haven't seen the opposition's testimony, so I'm not sure what the opposition is about.
It seems there are like 8 or so people opposed, and only one of them explains why, with the statement about people have the right to place their elderly where they want, etc.
They have the right to place their elderly where they want, but if someone is running a business that is providing 24-hour accommodations to someone unrelated to them for a fee, and that person requires care, then that's the criteria for licensure for an adult residential care home.
All right, thank you.
And just a clarification for the Department of Health, what we're striking is the exclusion under which individuals or businesses may be hiding beneath, which is to call themselves landlords.
That's correct.
Thank you. Okay, moving on, Senate Bill 162 relating to dentistry licenses. Members, first up, we have in support Department of Health. Dr. Fink or his designee.
I'm sorry, 1370?
162, this is relating to dentistry licenses. And it's in support, okay? Board of Dentistry comments. Aloha Care in support.
Good morning, Chair, Vice Chair, members, just standing on our written testimony and strong support.
Thank you. I apologize, going back to the Board of Dentistry, we have Sheena Choi via Zoom. Is there a Sheena Choi via Zoom? Ms. Choi?
Her mic is not on.
Ms. Choi, your microphone may not be on. Can you turn that on? And we will come back to you as soon as that's dealt with. We will go now to in support Hawaii Dental Association, Melissa Pavlicek.
Aloha and good morning. I'm Melissa Pavlicek on behalf of the Hawaii Dental Association. We have nearly 1,000 members in the Dental Association, which is the vast majority of dentists in the state. I noticed that in some testimony in prior committees, there were comments from other organizations saying that we have a shortage of dentists in Hawaii. We actually have the 5th largest or highest number of dentists per population in Hawaii, according to National Health Policy Institute reports, and we support implementing adult dental Medicaid, and just want to note that we support this measure as a means of getting additional dentists into the community health centers, and wanted to assure you that we do have a large amount of dentists in our state.
Thank you, Ms. Pavlicek. Via Zoom, we have Patrick Donnelly, and then we'll go back to Ms. Choi if she's still there. So first up, Patrick Donnelly from Hawaii Oral Health Coalition, Hawaii Public Health Institute, in support.
Hi, good morning. Good morning, Chair Bellotti, Vice Chair Takanochi, and members of the committee. We are thankful for the opportunity to testify in strong support of this measure. This is a no-cost, impactful way of increasing providers where they're greatly needed. You know, we do have good, I suppose, rates of dentists overall, but that's highly concentrated to Honolulu. So this is particularly impactful in the community health centers, Native Hawaiian health systems, and also on the neighboring islands and rural areas. So otherwise, stand on our written testimony and strong support. Thank you for the opportunity, and more than happy to answer any questions you have. Thank you.
Thank you. Ms. Choi with the Board of Dentistry.
Good morning. Sorry for the technical difficulties earlier. Good morning, Chair, Vice Chair, members of the committee. My name is Sheena Choi, Executive Officer of the Board of Dentistry. We would like to stand on our written testimony and are available for any questions. Thank you.
Thank you. Members, we have testimony in support from Hawaii Dental Service, We Are One Inc., Hawaii Children's Action Network Speaks, Ho'ola Lahui Hawaii, and comments from Grassroots Institute of Hawaii. We also have testimony in support from Don Sand here in person. Dr. Sand?
Aloha, Chair Alboati and Vice Chair Takanuchi and distinguished committee members. I'm Dr. Sand. I stand in strong support of Bill SB 162, SD2. Even though I'm a part of 4 different oral health care coalitions, 2 national best practice and 2 local, today I'd like to testify as an individual frontline dentist who for 8 years has learned the needs of the patients, have learned the needs of the dentists serving these patients, and have been privileged to be part of helping the safety net organizations with this work shortage. Thank you for supporting this measure that aims to clarify the intent of the original bill, and that is to increase the number of eligible quality dentists and hygienists to bring care to, we're talking about the most vulnerable and underserved population. I stand by my written testimony and will only lightly highlight one of the provisions. And in that written testimony, we're humbly asking, please clarify the language used to describe any alternative venues with the new phrase community health center to include both the underserved programs that are now in operation and the ones that are being developed and proposed to meet this capacity shortfall in the underserved community. The risk without defining these other essential venues in the new term community health center, there could be a misinterpretation of the language to mean that only federally qualified community health care centers are allowed to recruit these community service licensed professionals. And this may result in some of these essential public health venues not being able to recruit from the pool of these lower cost dentists or even to hire the volunteer hygienists or dentists that are wanting to help us. Thank you for this chance to testify, and I'm available for questions.
Thank you, Dr. Sand. We have next up in support Dr. Andrew Davidson via Zoom.
Hey, good morning. Just wanted to thank you for listening to this bill and my testimony. I just want to stand on my written testimony. Thank you.
Thank you, Dr. Davidson. Members, we have testimony in support from James Nelson, Nancy Partika, Andrew Kagimoto, Ellie Kelly Miyashiro on behalf of Hawaii Dental Association. Any other testifiers in Zoom? Any testifiers in the room? Are any testifiers in the room? Late testifiers? Seeing none. Members, questions? I have questions for Department of Health, so you might have to come up here. I also have questions for Ms. Pavlicek and possibly Dr. Sand. I hear the concern from Dr. Sand about including additional organizations, i.e. rural health clinics, Medicaid clinics, mobile dental outreach to homeless and primary prevention programs. And he cites 4 specific kinds of programs that are now operating, including the Keiki Sealant program in our Title I school-based programs. My understanding is that, are we covered in that area with a community license? Because I believe that there's a dental community license that the Department of Health utilizes.
Correct.
So that would not be a program that needs to be covered by this.
I'll need to check. Our community, the license that the Department of Health issues is to make it a little administratively simpler for dentists to practice in underserved areas. But in terms of what specific federal designation, RHC, I'll need to get back to the committee.
Okay, because my understanding is that is a pilot program, right, between DOE and DOH at certain, or not a pilot program. There are instances where Keiki Sealants and ADH, in collaboration, that there are dental sealant programs in the public schools, and
Correct.
that it's done under the licensing of a community license at some point.
I don't know off the top of my head, but it is very likely. So I recall working on that at the beginning of that project many years ago, but I'll need to check on the details, and I'll get back to this committee.
I believe that's when you and I were doing the same dance several years ago. Okay.
Yep.
Also, my question is, would there be language to cover things like mobile clinics? Because I know groups like Aloha Vision or Vision Project, when Project Vision has partnered with other
yes, to great success.
Professionals during the pandemic, and so we actually extended outreach into the public in a far deeper fashion than just through the community health centers. Is there language out there that would cover those kinds of programs?
If there isn't, we will try to draft it for this committee and get it to you hopefully by the end of today, because it sounds like a very good idea that it's the federal designation of medically underserved or health professional shortage area, not the building per se, which is, I guess it starts off, people think of the federally qualified health center, but it's the population that we're getting at. So if you happen to have a mobile clinic in a medically underserved area, it makes a lot of sense for the department for the same license to apply itself to those interventions as well. So we'll take a look at that and be happy to
And then one more thing,
propose
give
amendments.
you more
Yes.
homework. You know what, I want us to be forward-thinking in this. So as we are looking at developing behavioral health centers, drop-off centers for homeless outreach, all of these things where there might be clinical settings where we could have dentistry services, we need to do that. We need to think about that. And so if this is an opportunity to maybe broaden this a little bit, but make sure that we're having outreach in these settings, this is going to help our community people.
I think that's a fantastic idea, one-stop shop, taking advantage of whatever crew or mobile outreach clinic is there to provide as comprehensive array of services as possible. Makes a lot of sense and is in the true spirit of public health, so we'll take a very serious look at that.
Okay,
Get back
thank
to you with wording.
Thank you, Mr. Kim. Ms. Pavlicek? Two different questions. Would you be willing to help us kind of think through some of this? Because I think we have to think about these settings more broadly.
Absolutely, yes. Mhm.
Okay, and then secondly, I know that as this bill was moving through the previous committees, have we gotten the language correct about accredited, recognized, all of that? Is that solid now?
Yes, I believe so. We asked that it be changed to schools that have reciprocal agreements with the college on a dental accreditation, and that was changed in a prior committee. That seemed more specific than just the word recognize, which we weren't quite sure what recognize meant. My understanding is that there is a reciprocal agreement with Canadian dental schools, so that is, I think, the primary impetus. We've been participating with the Hawaii Oral Health Coalition. You heard from Patrick Donnelly today, but they've been really leading this effort, and we're really pleased to be a part of it, to support this bill, and glad to work with you outside of the committee hearing room.
Okay. I don't think I have any other questions, actually, so Dr. Sand, you're off the hook. Any other questions, members? All right, seeing none, let's move on to relating to the practice of pharmacy. This is Senate Bill 473. First, we have comments from the Board of Pharmacy, James Skizuski.
Good morning, Chair and Committee. I'm James Skizuski, Executive Officer for the Board of Pharmacy. You have my written testimony, and I'll be available for questions.
Thank you. We will have questions, so stay close. Melody Aduha, support. Environmental Caucus of the Democratic Party of Hawaii. Liberty Dialysis, Fresenius Medical Care North America, Maria Garcia in support. Okay. Any other testifiers in the room? Any other testifiers via Zoom? Members, any questions? Mr. Skizuski, I have some questions.
Of course.
I know you raised some questions that is unclear whether these amendments will apply to in-state or out-of-state prescription wholesale distributors. Isn't it in the language of the current bill that the manufacturer's agent is already properly registered with the board as a manufacturer or wholesale distributor? So you actually do know the population who this may be affecting?
Yes, we do register in-state manufacturers and distributors.
And not out-of-state?
Not out of state.
So by the language of the amendment itself, this is going to only apply to in-state registered manufacturers or wholesale distributors,
Yes.
right? And then in this instance, do you know how many of these distributors there are?
No, I'm not aware of that number.
Okay, maybe as we move forward, if we can, you can provide to the committee members who this may be affecting, and if this is, and what are the regulations around this registered group?
Yes, so the main gist of this issue, and in speaking with stakeholders in relation to the proponents of the bill, they were trying to skip an additional step of having a pharmacist on island because they believe a pharmacist that sending on the mainland who are transporting the drugs to our island is enough to kind of skip the pharmacist, but that isn't what pertains into drug manufacture in here. Manufacturers on island are meant to distribute the drugs to people other than the consumer, so it'd be to hospitals or to other pharmacies. So I was a little confused on the purpose of the bill. There are certain carve-outs in our statutes related to medical oxygen that they can distribute directly to consumers with a prescription. That's what I tried to speak with the proponents of the bill, is they should be looking at something more along those lines rather than what their intent is, because what they are trying to do is address, I believe, pharmacy permits where the drugs would go to a pharmacist and then the pharmacist dispense them to a consumer. But I can get you the information on affected parties. We'll have to do a little bit of digging, and I will do the best that I can to get you that information.
Okay, where is the section in the law that applies to medical oxygen being delivered?
It's in the definitions of 461.
So my understanding is this would be dialysis drugs and devices that go directly to consumers, much like the way medical oxygen would be going directly to consumers. So there's a parity here, and if this is simply to make sure that this is happening more streamlined, that is a positive thing. I think we should look into this. I appreciate the fact that you'll get back to us with some of that information, but likely this will continue to move on. So I encourage you highly to continue to work with the stakeholders on this one. Just separately, is there a fee related to the registry of these manufacturers or wholesale distributors?
Yes, I mean, we issue them a license.
Okay, so there is a fee that you gather from this thing.
Yes.
So you would still not be losing that even if we did this.
Yes, so
because they're registered.
Yes.
Okay, thank you, Mr. Skizisi. Members, any comments, any questions? Okay, Senate Bill 759 relating to health. This is the Office of Primary Care and Rural Health. Dr. Fink or his designate from the Department of Health in support. We have testimony in support from the Office of Hawaiian Affairs, Zuri Aki. We have testimony in support from individuals Nash Whitton and Caroline Azulski. We have numerous testimony in opposition from individuals, and we have Logan Yogi on Zoom in support. Hawaii State Youth Commission, not present. Okay. Support from Hope Services Hawaii. Is there anyone in Zoom who would like to testify? Anyone in the room who would like to testify?
Yes, can I testify?
Oh, go ahead.
Aloha Chair, Vice Chair, members of the committee. My name is Logan Yogi, and I'm speaking on behalf of the Hawaii State Youth Commission. We are in strong support of SB 759. As mentioned in the bill, one of the most critical issues in Hawaii's current public health situation is inaccessibility and its effects on disadvantaged communities. While healthcare services are ubiquitous in the urban centers of Oahu, many rural and low-income communities are unable to access them. All Hawaii residents, regardless of their location, socioeconomic background, race, and ethnicity, should receive the same quality of care. To do this, we must aim to expand outreach efforts and healthcare resources to the communities that need them most. Establishing a pilot program in Hawaii County, along with a comprehensive 2030 shared health vision plan, is a crucial step towards making Hawaii's public health system more accessible and equitable. Mahalo for the opportunity to testify, and I'm happy to answer any questions.
Thank you, Mr. Yogi, for joining us and serving on the Hawaii State Youth Commission. Any other testifiers in the room? Members, any questions? I have a question for the Department of Health. This federal grant that currently funds the office, is this a recurring, ongoing federal grant, or is it a time-limited grant?
It is been an ongoing grant. My office actually ran the rural health program for a stint. It's been in effect since, I want to say, at least 2009. It's from the Office of Rural Health Policy and Health Resources Services Administration. So it has been fairly consistent and reliable throughout the years. It began, the grant was conceptualized to help convert hospitals to critical access hospitals, and the need for rural health became readily apparent. And so, like I said, it's been pretty reliable. All 50 states have one. There's an association, National Association of Rural Health Offices. So there's a pretty robust infrastructure, and insofar as the federal government throwing resources into development of rural healthcare access, it's pretty reliable.
Okay.
Yeah.
Is the suggestion of this bill and the scope that it would like to expand the office into, do these projects fall within the federal grant?
Broadly, I think so. So the Access to Care report that came out really brought a new dimension to neighbor island and rural access. We've seen all the numbers from JABSOM and the ratios of the numbers, but what was very compelling about the Access to Care report was that there were a lot of qualitative, informative interviews and people expressing kind of the stress of not being able to get an appointment. So that really helped round out our understanding that this really is not just a numbers game and it's a federal designation, that we really need to get out there and understand the needs of the community. So to the extent that, yes, that this does fall, I believe it should fall within the scope of the overall rural health grant that we have from the Office of Rural Health Policy.
But certainly additional funds could help because of the acuteness of the problem.
Definitely, and one of the things that the Department of Health is realizing is the planning has to happen in the community, and for a jurisdiction like the Big Island, who has really self-organized, for the community has really, in the last 15 years, took it upon themselves to lead their own community conversation about health planning, beginning with Mayor Kim's emergency proclamation, on through North Hawaii Outcomes Project and Community First and Beacon Project. That's the missing element in this, and that's the secret sauce, is making sure that the community is expressing their needs. So to the extent that the legislature can appropriate funds, that we can develop models and figure out how we can engage rather than do planning from Kinauhale or from Hawaii District Health Office, I think that would be absolutely essential so that we can have a more complete understanding of what people's needs are.
Okay, thank you, Mr. Kim. Members, any questions? Representative Kobayashi.
It seems that this bill started off as a pilot project for one specific area of the Big Island. And now the bill talks about developing a community plan for the whole state, not just that particular area of the Big Island?
It did start out, this was Senator Kanuha's measure, and it
Yes.
did start out with a focus in his district as a response to the Access to Care report. Let me read this real quick.
But then, if you read the bill,
Right.
now there's no specific area designated for this development of community plans, et cetera. Like,
Yeah, no, thank you for that observation. That just dawned on me at this from your prompting. I think there was likely an understanding that the Office of Rural Health and Primary Care is going to start on the Big Island. The department, I'm going to introduce into the concept, but the department is considering public health accreditation, which requires statewide planning that necessitates community input. So we are trying to figure out how we muster our resources to address statewide community planning, reinvigorating the state health functional plan. But I think it would make sense for the Office of Rural Health and Primary Care to start on the Big Island, even though that's not explicit in this measure. Like I said, we are looking for a model to be able to get out there and increase community participation, and we don't want to do all counties at once. So maybe taking advantage of the fact that the Big Island really has organized itself and has taken an interest in their own healthcare future, it seems like a good place to start. What lessons we learned there, we can apply to other jurisdictions. But thank you for pointing that out. That escaped me.
I think that as you look at the funding for a 1 FTE, while there should be a lot of focus on one pilot program, I think an individual could work at multiple, can multitask.
Definitely.
And so could have in different phases, different progress on the on the formulation of plans for different counties and regions.
Yeah,
So
I think
it's something that's
phasing,
doable.
staging it and phasing it would make a lot of sense operationally.
I really appreciate this bill. I think actually we are seeing a huge crisis in the rural areas. So this may actually be a very good, wise investment, a strategic investment.
Without a doubt, there is a crisis in the neighbor islands in most places.
All right, thank you, Mr. Kim.
Thank you.
Seeing no further questions, moving to Senate Bill 1215. This is our healthcare preceptors tax credit. We have testimony in with comments from Department of Taxation, Gary Suganuma, or his designee.
Good morning, Chair, members of the committee. My name is Kathy Davenport. I'm here on behalf of the Department of Taxation. I want to thank you for allowing us to testify. The department does stand on their written testimony and providing comments, and I'm here for any questions that you may have. Thank you.
Thank you. We have testimony and support from Laura Reichart, University of Hawaii, Hawaii State Center for Nursing.
Good morning. My name is Laura Reichart. I'm the director of the Hawaii State Center for Nursing. I'm also an administrator of the Preceptor Credit Assurance Committee. I just want to verify that we have talked with all of the other professions who are asking to be included, as well as reviewed the inclusion of behavioral health. We have the capacity within the current tax credit program, and we've been able to functionally administer this program with success. So we are we're very thrilled with this bill in its current form, and are looking forward to implementing it in the future.
Thank you. Hawaii Primary Care Association in support, Eric Abe. Support from Hawaii Academy of Physician Assistants, support from Hawaii Association of Professional Nurses, support from Hawaii Medical Association, support from Hawaii Pacific Health, support from Kaiser Permanente, support from Queens Health System, comments via Zoom for Tax Foundation of Hawaii.
Thank you, Chair, Vice Chair, members of the committee. Tom Yamachika from Tax Foundation. Will stand on a written testimony and be available for questions.
Thank you, Mr. Yamachika. Testimony and support from Nash Witten, Thomas Jocelyn. Lay testimony from Andrew Kagemoto, individual in support, as well as testimony and support from Dr. Fink, Department of Health. Okay, any other testifiers via Zoom? Any other testifiers here in the room? Seeing none, members, questions? Ms. Reichart, I have some questions. So the pilot program beginning in 2018 was supposed to be 1.5 million annually for 5 years. We're coming up on the 5th year this year.
Is that true? 19, 20, 21, 22, 23, yes.
Okay. And we have not spent the full 1.5 million. So has the money just continued to be lapsed back?
So each year there is an allocation of 1.5 million. And whatever we don't spend within those or allocate within those tax credits just remains within the revenue. So it doesn't, if we don't spend it, we don't accumulate more for previous years, I think is the question you're asking?
Yes.
Okay.
You know, then this might be something the tax department has. I mean, do we know what the split is between doctors, osteopathic physicians, APRNs, and pharmacists?
If you give me one moment, I'll pull up I have that spreadsheet and I can provide that.
Okay, I'd be interested in if you can provide that information to the committee. We don't have to go through that now. I guess in looking at your testimony or testimony on this measure, there seems to be barriers to getting just those professions. Why are more not qualifying? And why should we not address those factors?
So this measure actually does address those barriers. So what this measure does, the two main barriers we identified, it's starting actually in 2019, which was the first implementation year, was that two things. One is we have many more healthcare professionals, physicians, APRNs, pharmacists who engage in training, but the way the language is written is that it's for primary care providers who train future primary care providers. But for instance, I'm an adult geriatric primary care nurse practitioner. I trained under a pulmonologist. based off how this would be, how this is written in law right now, we can't give that tax credit to the pulmonologist who's training the future primary care provider. So we'd like to remove, and it's in this current version, we want to remove the description that it's primary care providers who train future primary care providers. And instead, we're asking it to be providers who train future primary care and behavioral health providers. That will actually open up, and we have the data to support that. That will open up hundreds of more tax credits for those people who are currently doing the training. And then after that analysis, we've identified that there still is some room. And so that's why we really felt that there's a good opportunity to bring in PAs, to bring in registered dietitians, to bring in social workers, because beyond that, we're seeing that would bring us up to about $800,000 or $900,000 worth of tax credits. And so if the state had allocated $1.5 million, can we use this vehicle to continue to support the workforce development for our local healthcare professionals?
Okay. I appreciate that this bill includes behavioral health, I understand somewhere, and that includes social workers.
Yes.
I guess this raises the question, and I hate to add another group to this because then it might take you up to the 1.5 million or over. But is there any reason why psychologists were not included?
There's no, from my perspective as an administrator, as long as they are licensed in the state, there's a local school, and there's local providers, we absolutely could include them. I think practically they have all of the criteria. We've just had trouble getting in touch with them. And so it hasn't been a lack of our interest, it's been
okay, that is sufficiently, I guess, as we hear and know that the mental health issue for the House has been a very big concern, the need for more licensed psychologists in the community would absolutely help that.
Absolutely, and they're a critical workforce and a wonderful workforce, and I know that we have strong academic programs in our state. I also just want to highlight that JABSOM does have psychiatry, and then we also have two nursing schools, and a third is working on opening up a psychiatric nurse practitioner program. So while we don't have psychology currently written in, we do have other existing programs that would benefit from this program that both can do counseling and prescribing. So certainly the environment for behavioral health, I think, is a priority for everyone. I just want to recognize the strengths of the current workforce included here.
Okay, would psychiatrists fall under the physician?
Psychiatrists do fall under physicians.
And the APRNs, psychiatric?
The psychiatric mental health nurse practitioner programs are at HPU and Chaminade, and UH Manoa is investigating if they would open those. So those three schools actually are already included, and the language currently written is broad enough that we wouldn't have to change anything to include them. Yeah.
Yeah. Okay, that's all the questions I have. Members, any questions? All right. Thank you, Ms. Reichart. Moving on to House Senate Bill 755 relating to disability health disparity. We have Daintree Bartoldes, Hawaii State Council on Developmental Disabilities in person, or her designee.
Aloha, Chair, committee members. My name is Jay Silver. I'm with the Hawaii State Council on Developmental Disabilities. I'm here for Daintree Bartoldes. We just want to stand our written testimony in strong support. We did want to highlight that the original appropriation amount for this bill was $500,000, and that is the minimum amount needed to kind of successfully do the study at this scope. Thanks much.
Okay, thank you. Testimony in support of Disability and Communications Access Board, Kirby Shaw. Testimony in support, University of Hawaii, Denise Ebby-Conan. With, I believe, the College of Social Sciences and Social Sciences. Support, Office of Hawaiian Affairs, Zuri Aki. Support, Hawaii Disability Rights Center, Lou Erdeshek. Support, Alzheimer's Association. Support, Hawaii Primary Care Association. Support, Epilepsy Foundation of Hawaii, Naomi Manuel. Testimony from individual in support, Ka'ili Swan via Zoom. Mr.
Good
Swan,
morning,
are you
Chair,
there?
Vice Chair, and committee members. My name is Kari Swan. I am in strong support of SB 755 because people with disability have unmet needs regarding access to healthcare. Thank you for allowing me to testify, and I'm available if you have any questions. Thank you so much.
Thank you, Mr. Swan, for joining us. Ms. Nancy Partica, individual in support. Daniela Bond-Smith in support. Ruben Juarez in support, individual. Susan Oka, individual in support. And Mr. Juarez, I'm sorry, going back to him, is from the University of Hawaii at Manoa, professor in health economics. Any other testifiers via Zoom? Any other testifiers in the room? Go ahead.
Aloha, Chair, Vice Chair, and the Committee for Health. Angela Melody Young, and I'm going to testify to provide comments. So this measure is seeking information that can be accessed from the Federal Social Security Administration and the state's Department of Human Services. So SSA and DHS already has comprehensive information, and it defines disabilities, including a myriad of medical conditions ranging from neurological conditions, lymphoma, cancer, to developmental disabilities. Also, Disability and Communication Access Board, the Hawaii Disability Rights, University of the UH's Disability Studies, and the SPIN Network are good resources to access to learn about what the measure is requesting, and to gather medical data from those resources to study the socioeconomic factors and the health inequities and the health disparities, right? So the focus of addressing disability health disparities and inequities should not only be to define it, but to legislate and implement effective policies. So I think it's on the last page, item 4 and 5, right, to for more accessibility. And there should be a focus on creating educational campaigns to raise awareness about disabilities, to teach the public, and then also creating more accessibility through Social Security benefits and DHS benefits, and then motivating Social Security lawyers to help the disabled access benefits and integrating support services. So disabled people need lawyers who know disability rights. For example, there's a big need for lawyers who know Social Security law. However, they work on a contingency fee basis and receive payment after the SSA approves the claim. So disabled students need to act, and also disabled students, right, need to access.
Ms. Young, can you wrap up your comments? We just have to move on, but I do appreciate your comments, and we could also take it via a written response as well.
Okay.
So if you could just wrap it up.
Okay, so in conclusion, in order to get these services, there may also need to be legislative parameters for Medicaid and medical care reimbursements to motivate them to work with disabled people. Thank you.
Thank you. Any other testifiers? Seeing none, members, questions. I have a question for Mr. Silver, real quick. The testimony of the College of Social Sciences, Dean Conan, raises a really good point about trying to make sure that we preserve the data collection efforts so that it can be reoccurring. So is there a way to do this study with an eye to the future so that we don't have to reduplicate or reinvent the wheel if we are able to continue this?
I would want to say yes and no. I think there are parts that can be recurring. One of the main intentions of this bill is that we do have a very large gap group for our IDD population that we don't really know anything about. And so this is one of the main points of that. That, while we would like that to be recurring, we don't know how much that would be reproducible, as we are trying to find that group and figure out what their needs are. We are working closely with UH on this kind of measure and this topic. They do have a plan to create basically a reoccurring database, and there's no reason why when we do this study we cannot work with them to make sure it fits their parameters as well.
I think that's really critical, because if we make this strategic one-time investment, if it can reproduce assets into the future so that we can better understand this population and the tools, right? It's the questioning tools, it's the outreach tools. If we can build that, what is essentially infrastructure, then we have made a wiser investment than just a one-time study.
I agree. There's no reason we can't do that.
Okay, thank you. Thank you. It's good to hear that kind of commitment. Members, any other questions? All right, seeing none, moving on to Senate Bill 346. This is relating to emergency vehicles. We have testimony in support from the Waikiki Neighborhood Board. Robert Finley, also Daniel Jacob from the Waikiki Neighborhood Board. We have testimony in support from Curtis Miller, Liliokalani Gardens, AOAO. Testimony in support from Jay Henderson, Citizens Against Noise. Testimony in support from State of Hawaii Organization of Police Officers, which is, I think, unusual, members. I don't know that they've ever testified in support of this before. We have numerous testimony in support from individuals. Lynn Natasau, Denise Bosivert, Kim Jorgensen, Michael Misher, Roland Nips, Margaret Murchie, Pam Walker, and Carolyn Azelski. Any other testifiers in Zoom? Any other testifiers in the room? Seeing none. Members, any questions? Seeing none, moving on to Senate Bill 390. This is relating to emergency medical services. We have testimony in support from the Hawaii Medical Board. Alani Kigogi.
Good morning, Chair, Vice Chair Alani Kiyoki with the Hawaii Medical Board. The board will stand on its written testimony in support and asks for a clean effective date. Thank you.
Thank you. Members, we have testimony comments from Department of Health.
Thank you, Chair. The Department of Health takes no position on the repeal of Section 2 of Act 119 SLH 2021, but we do request a friendly amendment for a second appropriation. We'd like to open a conversation as we talk about the emergency medical response workforce. Emergency medical transportation goes hand in hand with that. And the recent tragedy with the life flight in December of 2022 really exposed the lack of resilience in our neighbor island and overall statewide air ambulance network. So just as a placeholder to open a conversation on various ideas that the department is coming up with to address, to make our air ambulance network a lot more resilient. And I have Dr. Bronstein, who's the subject matter expert in emergency medical services, available for any questions. And so, I submitted late testimony. Do you have our copy of our amendments?
We do have a copy
Okay.
of your amendment.
Thank you very much.
Mr. Kim.
Thank you.
Thank you, Dr. Brunstein, for being here. Members, there has no other testifiers. Testifiers in Zoom, testifiers in the room. Seeing none. Members, questions? I have a question. Go ahead. Representative Kobayashi, go ahead.
I guess for either the Department of Health or Hawaii Medical Board, I don't understand why there's a special category for one county and for people who do not provide ambulance service. I mean, who are these people?
Representative, I can answer that question. The requirement for one county was actually taken out last session. So the EMT 1 category of emergency medical personnel addressed specifically the equivalent to like a first responder. So firefighters, police officers, if they qualify for licensure. Those individuals are not specifically tied to an ambulance service, but have gone on to get National Registry certification.
Oh, I see. And so this would apply now statewide?
Last year, there was
Yeah.
a measure, yes.
Okay. How many of these people exist?
We have licensed almost 100 individuals.
Okay, thank you.
Thank you.
Okay, members, any other questions? I have a question. I don't know if this is for Dr. Bronstein or Mr. Kim, but I think this really falls in line with the theme of the importance of addressing rural health again. This is completely an access and like life and safety issue. So I appreciate the friendly amendment, and one comment would be that I think you need to coordinate with the medical board.
Yeah, this is very last minute, and I will discuss with Ms. Keogh right after the hearing.
Okay, on that note, so like what is the kind of ballpark amount that you folks are going to be looking at for this?
I'll bring up Dr. Bronstein, but it depends on, there are several models that go from leasing on the low end to everyone gets a Cadillac version of a helicopter at the high end. So Dr. Bronson, can you provide a
Okay, if
little
we
more
could have a
detail?
range, and if you can describe what this potential is, just so we can inform the House members, especially the House Neighbor Island members, who this might be very important priority for.
Yes, ma'am, thank you. I'm Dr. Al Bronstein, the EMS Branch Chief for Department of Health. This proposal, this amendment, would allow us to implement a backup plan for air transport, inter-island air transport, through the Department of Health with a partnership with the neighbor island counties, because now there is no backup plan, which was recently brought to the forefront with the recent crash. So just as we provide a land service, a 911 service for ambulance, now we believe the state needs to take the initiative to provide this backup plan for the state. This would not supplant the private enterprise air ambulance services, but give us the resilience and resource should the air services, the private air services, not be able to serve the state. The other thing we want to serve also, there is a significant population of patients who are large or bariatric populations, and right now, other than the Coast Guard, we have no way to transport these patients from neighbor islands to Oahu. So we want to take care of this group of individuals. As far as cost, there is a wide range for the type of helicopters we are proposing. To procure one for $10 million is just for one. However, we are scoping out other ways to do leases, which are much more cost effective. We also want to factor in what we call predictive maintenance, where it's possible to predict what parts one will need as helicopters are used. So there is a wide range, and we would appreciate the opportunity that we can give you some exact numbers on what this would cost. But we think leasing, some sort of lease program, would be very cost effective and beneficial for the state. The bottom line is there are several models, but we believe, the health department believes now is the time. We must take this action because there are going to be, things will happen that we don't want to see happen if we don't have a backup plan.
Okay, what is on the lower end? Because when I hear $10 million for purchase of a helicopter, then you have to pay for a pilot, and then there's benefits, so that's a really large ticket. On the leasing end, what is the ballpark figure for the leases?
Okay, thank you, ma'am. So one point I need to emphasize is this would be a state partnership with the neighbor islands, and the neighbor islands have pilots actually. So we have that capability. Some of the neighbor islands have medical personnel to staff the units. And on the low end, for a lease, for the type of helicopter we are describing, we're talking about $1.3 million per year. So we could get several helicopters through a lease program, much less than the $10 million just to buy one. So, and there's variations in between, and we do recognize there will need to be some infrastructure vis-a-vis hangars. But the other part to emphasize, this would be a partnership with the neighbor islands to build a resiliency for the entire state. And we think that's very important. And this model of the state-county partnership, we believe, is very important. And we have had some positive comments from the counties to augment the county services. These helicopters also could be used by the county for search and rescue, for other issues if they weren't doing medical transport, if the private air ambulance services were sufficient to transport the patients.
I think this sounds like a wonderful idea. Mr. Kim and Dr. Bronstein, I think we need to make that partnership explicit in the language. So I'm going to further amend or recommend amending this, because I don't want us to be in a situation where it's all general funds, and I appreciate that you have counties partnership, but we should make it explicit so that any general funds would be dependent upon ensuring that there is county skin in the game. And I don't know how we say that, but we will find the appropriate language to say that. Okay, any other questions? Seeing none, thank you. Thank you for offering this friendly amendment.
Yes, ma'am, thank you.
Okay, moving to Senate Bill 1370 relating to licenses to solemnize marriages. This is a governor's package bill. We have testimony in support from the Department of Health. Okay.
Good morning, Chair and members. Lauren Kim, Planning and Policy Officer for DOH. We strongly support this measure. It's about fairness. The department was sued several years ago because although we issue licenses to solemnize marriages for judicial ceremonies and religious ceremonies, secular or civil ceremonies were not allowed. And so working with the legislature, we were grateful for the fact that we now have a third category of solemnizer, and the solemnizer is the person who says, do you take this person to be your lawful wedded so-and-so? However, a fee was applied, but there was none before. But we think a fee makes sense because the department staff still do all the work. We have two versions. One is if you're a professional, you're in the wedding industry, we have a fee for that. And a second, much lower cost fee, and this is where we see the bulk of civil solemnization licenses, is for couples who want to get married by a friend or a relative. So there's a 3-month license that you can get, and that we're proposing, I think, $25. 60 days for $25, and it just gives couples options in the way they want to begin the next phase of their lives. So we look forward to the legislature support, and I'm available for questions.
Thank you, Mr. Kim. Mr. Kim, we received some testimony, but we might not have your complete testimony. So if you can just make sure that the staff has it.
It was late,
and we will get it to committee members.
Yeah.
Thank you.
Thank
Any
you.
other testifiers in Zoom? Any other testifiers here in the room? Seeing none, members, we are moving on to our, questions, concerns, nothing. Moving on to Senate Bill 944, relating to Uniform Parentage Act. This is a task force members, which I think is a very much better approach. We have comments from the judiciary, Judge Viola. Testimony in support via Zoom, Mr. Michael Goloyu Jr., Stonewall Caucus of the Democratic Party of Hawaii. If you are
Good morning, Michael Goloyu Jr., Chair of the Stonewall Caucus. We thank you for hearing this bill. We do apologize that our wrong written testimony was submitted. We are in support of this task force. We are asking for one amendment to include the Stonewall Caucus, as we are the state's only statewide LGBTQIA plus organization, and that we, for lack of a better term, religiously show up at all the hearings to deal with LGBTQIA bills. We do oppose anything that would expand the scope of this task force, as it already has a lot to cover. While we appreciate the intent behind some of the amendments that were requested about covering genetic markers or genetic following genetic parentage, that is not what the purpose of this task force is for. We feel that would open a can of worms that would require this task force to balloon in size, and it brings up a lot of host of other issues regarding the privacy of egg and sperm donors, rape survivors being made or feel that they must require the name of the rapist on a birth certificate. There are so many other things that this task force was not set up or even looking to cover that would be required for that to happen. We encourage those advocates to do what we have done and come forward with their own task force to cover those issues at a later date. So I'm available for questions. Thank you.
Thank you, Mr. Goloyu Jr. We have testimony in support from the Hawaii Women Lawyers. Testimony in support from Rainbow Family 808, Mike Goloyu Sr. Testimony in opposition for Moms for Liberty, Honolulu County. Testimony in support from Laurel Johnston. Testimony in support from Jay Takane. Support from Daryl Hand. Support from Abby Simmons. Support from Danielle Sato. Support from Madeline Cespera. Comments via Zoom by Kay McGlone. Ms. McGlone, if you could testify.
Aloha. Thank you for the opportunity to testify. The task force is a good idea if it represents all the key stakeholders. And right now there's one without any voice, and that's the children that would be affected. And can you hear me okay?
Yes, we can hear you. Thank you, Ms. McGlone.
Thank you. So changes to the parentage law would likely affect children created by assisted reproduction. And having donor-conceived persons or advocates for them, for those families, like the donor sibling registry, or advocates for children's right to know about themselves, information about themselves, is necessary to prevent updates to the law being written in a way that may have unintended harms to children. And the children and the adults they become do have a right to know and a need to know their origins, from whom they were created. There's a lot of experience and evidence, both from persons raised in closed adoptions that had all their information withheld from them, as well as a growing movement from donor-conceived persons who are also wanting that information about themselves. It is important. It's a really complex issue because of the assisted reproduction industry is unregulated. Many of the gametes used are established to be anonymous. So those are definitely complexities to this. So a task force is good to be able to work more of that out. And it's important that if advocates for children on the task force would focus on things like that it is important for children to have that and their families to have that background information of genetics for medical history and other important reasons, and that they have access to it. And also being in Hawaii, our cultural values for openness and transparency is demonstrated by the practice of Hanai, is also important to recognize where we are. It also would be worthwhile to look at options for should a birth certificate, a certificate of live birth, be the document that keeps getting amended, or whether perhaps there should be a parentage document for everybody, and that would both help with this. Because the certificate of live birth isn't set up for modern families or assisted reproduction. Okay, well, thank you so much for the opportunity to testify.
Thank you, Ms. McGlone. We have numerous testimonies in opposition, so I do want to read these names as this seems to be a very contentious issue. Michelle Melendez in opposition, Dara Yatsushiro, Allison Hammond, Joanna Weber, Susan Barakman, Rita Wong, Tiana Victorine, Jewel Rain, Maine Futo, Sarah Martins, Noella Vaughn, Ali Amadin. And numerous testimony, again, also in opposition. Chase Ioane, Jason Clark, Adrian Hugh, Maria Owl, Melissa S. Chang, Jessica Chiazzo in person. Is Jessica here in person or on Zoom? Annie Yu, Terry Yoshinaga, Teresa Lyons, Paula Blum, Donna Grabo, Nikki Ann Yee in support. Again, in opposition, Marlies Lee, Donna Melcher, Mary Mehelua, Mr. and Mrs. O'Neill, and Lei Tata. Any other testifiers via Zoom? Seeing none, any other testifiers in the room? Go ahead, Mr. Kim.
Thank you, Chair. The department did not submit testimony, but I'd just like to offer some information. I actually ran the first task force that Senator Keohakalole's bill in 2021 authorized. That's the work that Mr. Golehu refers to. I think he makes a good point. We uncovered a lot in that task force, including the fact that surrogacy is not explicitly authorized in Hawaii Revised Statute, or that's what I was told. So there was an opportunity many of the task force members thought that this is about all families, not just those who can carry a fetus, which is what the original wording of Senator Keohakalole's bill got at. So I think defining it, whether it's just to so I think definitions to control the scope, whether it's going to be this big, whether it's all families, regardless of your mix of chromosomes, or whether you were a product of artificial reproductive technology or Hanai, or more narrowly, I think would benefit, because the conversation was sprawling. And it did reveal that a lot of work needs to go into updating uniform parentage for a lot of people. We took the position, the department ultimately took the position that we would like to see something for all families, but we certainly understand stakeholders looking to fix their community's issues. So I think I just want to provide information on the conversation we had and just by virtue of the diversity of the testimony, how many people from a tremendous differentiation of backgrounds and circumstances need some clarification on the issue of parentage. So whether we do it in stages or one fell swoop, that's something I think that the committee should consider if you're going to amend and move this bill forward.
Mr. Kim, can I request, and you can take some time, to draft some comments based upon what you said verbally and provide it to the committee, because I think it is important information. And
I'll
if
have
you
it by
could
this afternoon.
Stay there for a minute. Any other testifiers in the room? Members, any questions? Okay, one more testifier, and Mr. Kim, please stay nearby because I do have questions.
Yes, thank you. Cynthia Bartlett. I think there needs to be more explicit wording in the task force, especially around the gender-neutral wording idea. I feel like this is going to push the gender-neutral wording, and many parents that I represent oppose eliminating the phrase mom, dad, uncle, aunt, and these words. I also saw on the task force a very heavy skewing towards the more LGBTQ group, like the Affirm and the gentleman who just posted. And I think we need some biological representation here that takes things more down to earth, and we're not just going to go into gender ideology on top of things, because that is a cultural construct, and we need to get the biology included and be more explicit. Thank you.
Thank you, Ms. Bartlett, for your testimony. Any other testifiers? Members, questions? Mr. Kim, is there a report available from that first task force?
Yes, I will forward it to your committee.
Okay, and I'm sure you didn't have an opportunity to look at this. There's requests in here to limit and push the report back to the legislator in a quicker manner. I actually, and that's from the Hawaii Women Lawyers, who normally I really take their recommendations, but I actually think that this is, like you said, a far bigger issue. And task force do not belong to one community group over another. These task force are created by the legislature.
Correct.
They are for our community that includes everybody. So do you agree that perhaps we should take a longer spin on this so that we maybe should have a report back to the legislature in 2025?
Gosh, I mean, we need to take what time we need. And again, if the legislature wants to focus in on particular aspects of parentage or the whole thing, that's your call. That's the reason why I wanted to share my comments. There was model law that we submitted with the report identified by a member who was a family court judge. I think that's actually moving. That might have crossed over. It's a place to start, but it doesn't. I guess I'm struggling to answer because although the Department of Health is interested in making all families whole, this is really a legal issue. This is about writing statute that will accomplish the goals that we need for whatever population the legislature defines. So my agency can only go so far at this point, cheerleading. This is really a bunch of lawyers rolling up their sleeves with advocates pointing the way from their own perspective and writing law. We don't need another report, we need law. So I think the report identified the various groups, the stakeholders who are suffering and could benefit from this. But another report is, it may uncover more perspectives, but it really gets down to what will the model law look like, or how, or who looks at the model law and turns it into an actual bill. That's where I think we are after
So what I'm kind of
several
hearing
meetings.
you saying is, as we look at the law, it has the Department of Health in the lead, but maybe we should put the Department of the Attorney General in the lead, because they have oversight of a broader understanding of all the laws that may be affected.
I can't speak for the willingness of the Attorney General, Department of the Attorney General, to lead this. We certainly want to see this through. My agency just lacks the expertise. This is
Okay.
really getting in there, like I said, rolling up our sleeves and going line by line, section by section of HRS and understanding what changes need to be made or not made to accommodate whatever scope that this committee recommends to the legislature.
Okay, and
But
because you
we're
led-
happy to be a part of the conversation.
Okay, because you had led the for initial task force, you know, this concern for adopted children to know their biological parent for purposes of their own health information is, to me, a very critical area, and that needs to be added to this. And so when people are looking at ways to address parentage and address maybe amending certificate of live birth, that becomes a very big problem, because now you're going to be stripping a future child potentially from knowing critical health information. And so that's an area that needs to be looked at, and it may not be in your scope of things, but was that surfaced in the task force report?
Definitely. I think probably the testimony of Ms. Johnston probably refers to that. And I guess a very quick response is, I have to wear two hats. One is the Department of Health, where the more you know about your health risks, is generally a good thing. But in terms of my former gig as acting state registrar, in terms of who amends the birth certificate or what it's called, that's a ministerial function. So I won't have an opinion on that. We do what the law says. You don't want the Department of Health deciding, what should be on a birth certificate or adoption certificate. We just have a ministerial function.
Mhm.
So this is, as you
It's a
quickly
policy
come to-
question.
It's a policy
There's
question.
a big policy question, sir.
And it's extremely complex.
Yes.
And so I think the report, which I'll make sure you get a copy of, identifies these large issues, but this really gets down to the nitty-gritty. This is who's going to write section in HRS.
Okay. My new catchphrase is, it's complicated.
It's complicated.
Things are complicated, and that's why we have task force that include all stakeholders. All right, thank you. Any other further questions, comments, or concerns? Representative Kobayashi.
Isn't this a situation that might have occurred in other states?
It is occurring in other states, and so the family court representative did produce some model law, and I think it's a good start. Some conversations I've had with people who understand the legislative process think it's not quite ready for our state, and so it needs some, not the, meaning the actual words, meaning we need to make sure that the model law is amended to suit our community and the way we look at, the way our law defines family. It's different from California, which I think is where that model law came from.
I see.
Yeah.
Okay.
This
Thank
really
you.
deserves a
So we
deeper
have
dive.
something that possibly could be a starting point. Okay. thank
Yes, and we submitted that as part of the report. And there was a minority report also that wanted to focus on non-hetero couples. So there even within the task force, there was a diversity of opinion, as the testimony of Mr. Goldhue alludes to, about what the scope is. And so I just wanted to make sure that the legislature was aware of that, and the department will, the executive branch will execute what the legislature decides.
Thank you, Mr. Kim. Exhaustive. That was very good. Thank you, members. Last bill, Senate Bill 106, relating to education, and I want to thank the Department of Education members for being here and staying through. But we are going to be thorough in this committee. So for this one, we have testimony in support from Department of Health, Dr. Fink, or his designee. In person, go ahead.
Good morning. Thank you for the opportunity to speak to this committee. My name is Caroline Pratt. I'm here on behalf of Dr. Fink and Dr. Sarah Kimball, a state epidemiologist, and DOH stands on its written testimony in support of this bill.
All right, testimony in support from the Department of Education.
Good morning, Chair, Vice Chair, and committee members. Annie Kalama, Office of Student Support Services Assistant Superintendent, offering testimony on behalf of the department. Thank you for hearing this measure, and the department stands on its written testimony in support of this bill.
Thank you. Testimony and support from Office of Hawaiian Affairs. Numerous testimonies of individuals, over 25 individuals in opposition. I'm not going to read the names on this one, members, just because I want to get to questions really quickly. Any other testifiers in Zoom? And we did also receive additional testimony in opposition from individuals. Any testifiers in the room? Seeing none, members, questions? I have a question for the Department of Education and also the Department of Health. Department of Health. It is easy to forget that we were living in COVID even just 6 months ago. So I was really appreciative of this bill and that you folks came forward and have collaborated on this. But I'm going to ask you to collaborate one step further, because I think one of the lessons learned is that in a pandemic, we need to have lines of communication clear. And I think the partnership that eventually developed between the Department of Health and Department of Education is exactly the kind of thing that we have to replicate in, God forbid, we have another pandemic. So I would actually like to have language, and it can be simple, such as a corona disease 2019 potential outbreaks or other pandemics or other public health emergencies as declared by the World Health Organization or as declared by something. Because I want this law to be in place, again, God forbid we go through another COVID pandemic. And it can happen. We did not think this was going to happen in 100 years. It could happen in 2 years' time. Can I get a commitment that you folks will give us some language to do that?
Yes, Chair, we'll work together on that.
Okay, thank you. That's all I have, members. Any other comments or questions? All right, seeing none, members, we are at the end of our agenda. Let's take a 1-minute recess, and then we'll come back and vote on our measures. 1-minute recess. Reconvening our Committee on Health and Homelessness, 9 o'clock a.m. agenda on Friday, March 17th, 2023. Members, we are going to take up each bill. Senate Bill 900 relating to Hawaii State Health Insurance Assistance Program. Members, I'm going to recommend House Draft 1, specifying what the progress report should include, including but not limited to the program's outreach and penetration rate with Hawaii's Medicare population. Information about the rate of working with or making sure that uninsured individuals are with medical or prescription drug coverage are identified, and progress report on whether enrollment in Medicaid, Extra Help, and Medicare savings programs are occurring with these low-income subsidy programs. I'm going to put a House defective date of our standard 3,000 House defective date, tech amendments for consistency, clarity, and style, and note positions and the request of money amount in the committee report. Members, any questions? Seeing none, Vice Chair.
Voting on SB 900 SD2, Chair's recommendations passed with amendments. Chair and Vice Chair vote aye. Representative Amato?
Aye.
Representative Iligan?
Aye.
Representative Kobayashi?
Aye.
Representative Mizuno? Aye. Representative Nishimoto is excused. Representative Garcia is excused. Chair recommendations adopted.
Thank you. Members, Senate Bill 1378 relating to unlicensed stay homes. Recommendation is to pass this one unamended. Unamended. Vice Chair for the vote.
Members voting on SB 1378 SD1, Chair's recommendation is passed unamended. Noting the excused absences of Representatives Nishimoto and Garcia, who will be considered absent for the rest of this agenda. Any reservations or no's? Hearing none, Chair recommendations adopted.
Thank you. Members, Senate Bill 162 relating to dentistry license. Chair's recommendation is to include rural health clinic and mobile dental outreach programs. These are going to be placeholders for those additional programs that may benefit, that we know that are occurring in the community. And then I'm going to add a House defective date of June 30th, 3000. And any tech amendments recommended by HMSO for clarity, style, and consistency. Members, any questions? Seeing none, Vice Chair for the vote.
Voting on SB 162 SD2, Chair's recommendation is passed with amendments. Any reservations or no's? Seeing none, Chair recommendations adopted.
Members, for Senate Bill 473 relating to the practice of pharmacy, I'm going to create a HG1 with a defective date of our standard June 30th, 3000, and any tech amendments identified by HMSO. Comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 473 SD1, Chair's recommendation is passed with amendments. Any reservations or no's? Chair recommendations adopted.
Members, recommendation for Senate Bill 759. 759 relating to Health Office of Primary Care and Rural Health. Chair's recommendation here is to defect the date of June 30th, 3000. Any comments, questions, or concerns? And any technical amendments identified by HMSO? Questions, comments, or concerns? Seeing none. Members for the vote.
Voting on SB 759 SD2, Chair's recommendation is passed with amendments. Any reservations or no's? Seeing none, Chair recommendations adopted.
Okay, members, for Senate Bill 1215, Chair's recommendation is to pass out with a defective date of December 31st, 3000, and any technical amendments identified by HMSO. Comments, questions, or concerns? Seeing none, members for the vote.
Voting on SB 1215 SD2, Chair's recommendation is passed with amendments. Any reservations or no's? Seeing none, Chair recommendations adopted.
Okay, members, for Senate Bill 755 SD2, Chair's recommendation is to put in our standard defective date of June 30th, 3000. And Note in the committee request that the request is, in the committee report, the request is for $500,000. Comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 755, SD2, Chair's recommendation is passed with amendments. Any reservations or noes? Seeing none, Chair recommendations adopted.
Members, Senate Bill 346 is to, yes, 346 is to pass unamended, as there are no other changes needed. Members, comments, questions, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 346, SD1, Chair's recommendation is passed unamended. Any reservations or noes? Seeing none, Chair recommendations adopted.
Okay, members, Senate Bill 390. Chair's recommendation is to adopt the amendment by the Department of Health, but to also add to the Section 2 language that essentially will make this appropriation and expenditure dependent on collaboration with counties and funding and or staffing provided in collaboration and partnership with the counties. All right. Members, any comments or questions? And a defective date of July 1st, 3000. July 1st, 3000. Comments, questions, or concerns? All right. Vice Chair for the vote.
Voting on SB 390, SD1, Chair's recommendation is passed with amendments. Any reservations or noes? Seeing none, Chair recommendations adopted.
Members, for Senate Bill 1370, Chair's recommendation is to pass unamended. Questions, comments, or concerns? Seeing none, Vice Chair for the vote.
Voting on SB 1370, SD1, Chair's recommendation is passed unamended. Any reservations or noes? Seeing none, Chair recommendations adopted.
Members, Senate Bill 944 relating to the Uniform Parentage Act. Members, lots of really good discussion, important discussion that I think needs to happen. I'm going to defer this for decision making to Wednesday, 11:30 a.m. of next week. Wednesday, 11:30 a.m. next week. Okay, members, on Senate Bill 106 relating to education, Chair's recommendation is to add HD1 that inserts after potential outbreaks the language or other public health emergencies, to keep the date as upon approval. And that's my recommendation, members. Members, for the vote. Vice Chair for the vote.
Voting on SB 106, SD2, Chair's recommendation is passed with amendments. Any reservations or noes? Seeing none, Chair recommendations adopted.
Thank you. Members, thank you for this very productive committee hearing. We will see you at 3 o'clock. We are adjourned.